You are listening to the Speech Space Podcast, a podcast full of tips and resources for SLPs. I'm your host, Jessica Cassidy, and this is episode 4. Hey everyone, thanks so much for tuning in to today's episode. This is the second part of a 3-part series on using mindfulness in speech therapy. It actually was supposed to be a 2-part series, but I just have so much to say about using mindfulness in speech therapy, I just could not do it concisely in 2 episodes. So I'm going to do it in 3. In case you didn't catch last week's episode, please make sure that you go back and give that a listen. The episode can be found at bit.ly/mindfulness in speech. Again, that's bit.ly/mindfulness in speech. And there was a link to the mindfulness basket in last week's episode. In this week's episode, I will be featuring a freebie, so make sure that you check out the show notes for today's episode. And I will also link back to last week's episode in case you didn't catch that, so you'll be able to easily access that. Okay, so mindfulness. We all probably have some general idea of what we think mindfulness is, but I want to get a little bit more specific. John Kabat-Zinn defines it as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Mindfulness can involve observation of both inner and outer experiences, acting with awareness, and accepting of both internal and external phenomena. There's various methods and interventions for utilizing mindfulness. We've got mindfulness-based stress reduction, mindfulness-based cognitive therapy, acceptance and commitment therapy, dialectical behavior therapy, and I'm sure that I'm missing a few as well. All of these therapies have been shown to reduce depression, anxiety, and psychological distress. Now, you might be wondering, how is this relevant to speech therapy? Well, we don't actually have much out there in terms of research in using mindfulness in speech therapy. However, I did attend a poster session at ASHA where a group from Towson University did a case study on incorporating mindfulness into a stuttering treatment program for an adult male who stuttered. So I'm going to talk a bit about what they did in that specific mindfulness program to give an idea of what a mindfulness program for a person who stutters might look like. There's also a wonderful article by Michael Boyle called Mindfulness Training in Stuttering Therapy, a tutorial for speech-language pathologists, which I highly, highly recommend if you're interested in incorporating mindfulness into your speech therapy sessions for stuttering especially. This could be very, very useful. And I will make sure that I link to that in the show notes as well. The article does a great job at describing mindfulness and giving specific ways to use it with stuttering clients. And let's go back to the study now that I spoke about, the case study that was done at Towson. So they incorporated a 3-minute breathing space mindful meditation practice into their treatment. Their subject was a 21-year-old male who was a severe stutterer, and he received 12 weekly individual treatment sessions that focused on stuttering modification, fluency shaping, and the use of a 3-minute breathing space video. They analyzed speech samples before the meditation, after the meditation, and after choral reading. And results revealed that this approach may have a similar or greater effect on reducing speech disfluencies when compared to other stuttering modification programs. Now, mindfulness measures did not show significant changes in scores, however. They did give valuable information regarding the participants' perception of mindfulness overall and after the treatment sessions. Pre- and post-treatment scores did show an overall decrease in stuttering severity and psychosocial well-being. Specifically, the SSI-4 scores went down and the OASIS scores as well. I'm sure most, if not all of you, are familiar with the SSI, but for those of you that aren't familiar with the OASIS, it's a measurement tool that allows you to assess the impact of stuttering in different life situations. And I will put a link to that in the show notes in case you're interested in checking that out. One thing that should be noted is that this data was obtained in the clinical setting, and we don't have any generalization data on the practice as of yet. So that's going to be all for today's episode. Next week, I'm going to dive in a little deeper to the Michael Boyle article that I mentioned earlier. So I hope you guys will come back and check that out with me. I wanted to just say thank you to all of you. I've really received an overwhelming response in my emails and on social media regarding the podcast. And I just want to say thank you for reaching out and thank you for being so appreciative. I really appreciate your kind words. You know, it can be hard to put yourself out there sometimes. So it's really nice to hear some positive feedback and to know that many of you guys are benefiting from these podcasts. And like I said, I try to keep them short and sweet because I know that we're all very busy, but hopefully you can catch it, you know, in the car on the way to school, while you're working out, you know, running from here to there. 5-10 minutes isn't too much time. So it makes it a little bit easier to squeeze it in. So thank you again. I really, from the bottom of my heart, I really, really appreciate it. So I don't know if you guys can tell, I have a very sore throat. I feel like my voice is kind of going in and out at different moments here. And I feel the need to disclose that since my audience is a speech pathologist. You guys are probably picking up on that. But anyway, thanks again for joining me for this episode. And I will catch you next week whenever I dive in a little deeper to that Boyle article and I talk a little bit more about some of his recommendations. And I also am going to talk about a few podcasts that I recommend to kind of piggyback on some of the recommendations that he makes. So the thing that's great about podcasts, of course, is that they're free. So you want to make sure that you check that out. And for today's episode, I forgot that I had a freebie for you guys. I need to throw that in before I sign off here. There is a freebie that I have that you can use. It talks a little bit about using a mindfulness basket in speech therapy, which I referred to in last week's episode. And also it has some nice visuals for working on smooth and bumpy speech and just trying to increase tactile awareness about the different variations in speech. So check that out. I will link to it, of course, in the show notes. And it's yours to use in your speech room. I hope that you find it helpful. All right, guys, thanks for joining me. I'll catch you next week.